Everyone, I'm Muriel Bowser. I'm the Mayor of Washington, D.C. I'm joined today by members of my administration to provide a brief update on the district's response to COVID-19 and a few general updates. We have a shorter presentation today, and then we'll take your questions. First, I want to start by thanking and congratulating DCPS, teachers, staff, students, administrators, and families who have helped to make the first week of district-wide in-person learning a success. And that also includes a big thank you to our DGS teams and our Emergency Operations Center who have been working for months to make sure that our schools are ready to receive our kids. So I want to give a big thank you to everyone who's worked hard to get in-person learning up and running. And I want to thank our teachers who are continuing to teach at home, also in a very difficult environment. There are still in-person seats available to families who have been previously contacted for a seat. So if you're interested in returning, contact your child's school to learn about any availability at your child's school. So now let's turn to where we are today with COVID on the metrics that we follow and report daily. You can see those numbers, and Dr. Nesbitt will be available to answer any questions about our daily case rate, which we have seen begin to decline over the last several days. We continue to monitor that closely, as well as the percent of COVID patients in our hospitals, which have remained in the red for several weeks. We also continue to ask people to be vigilant. Though we have a vaccine and we're deploying the vaccine aggressively, we still have to do all we can to prevent the spread of COVID by being vigilant, wearing masks, continuing to social distance, practicing good hygiene, and limiting your exposure, staying home when sick, of course, and eliminating unnecessary trips. I also want to say a bit about the vaccine. As you know, DC Health is producing numbers by to demonstrate how the vaccine is being distributed. These are the doses that we've received from the federal government each week. I think we're in the first week of this 3 years, the second week, Dr. Nesbitt will correct me, of the federal government letting us know 3 weeks ahead of time how much we should receive for the next 3 weeks. We still continue to report the doses by vaccine type, Pfizer or Moderna. You'll remember that they have different storage requirements, and we list the entities where each of how the doses are disseminated. So residents that are going to the vaccinate.dc.gov portal who are over the age of 65 or healthcare workers, we have shown that all of the 3,600 of the Moderna doses are going there. Also, we're distributing it to our pre-qualified health centers, DC hospitals, and One Medical and Kaiser, who are assisting us with vaccinating our first responders, teachers, and child care workers. Also, we want to just let members of the community know that the Mayor's Office of Community Affairs and the Mayor's Office of Community Relations, or MOCRS, have created a program called Senior Vaccine Buddies. And these buddies are members of our outreach teams who are going door to door in vulnerable areas to make sure that seniors have access to the information making sure that they can provide assistance in registering for appointments as well. So our buddies are out in the community today in Ward 8 assisting residents with signing up for the vaccine. Also want to make everyone aware that if you're a veteran who is over the age of 65, you may get a call from the VA to sign up for a vaccine. The VA has some number of doses. I'm not sure what it is, but they are vaccinating veterans who are over the age of 65. They've also provided this number, 202-745-8000, 202-745-8000. So please call the VA to get vaccinated. And speaking of members of the military, I wanted to announce that we've worked with our hospitality partners who make up the Hospitality Alliance, Destination DC, Events DC, the Restaurant Association of Metropolitan Washington, and the Hotel Association to launch DC Salutes You. And we are grateful for the many guards, men and women, and law enforcement officers who played a key role in securing the Capitol and ensuring a safe and dignified transition of power. And we want to invite them and their families back to DC to enjoy all that our city has to offer as soon as it's safe to do so. So through this program, they will get special deals and discounts at hotels, restaurants, and cultural attractions. And there is a website where you can learn more about the deals available at washington.org/DC Salutes You. And it is my understanding that more deals will be added over time. Next, we want to amplify what law enforcement needs as it relates to the events around January 6th. They are still looking for the person who placed 2 pipe bombs near the DNC and RNC on the evening of January the 5th. You note the pictures that have been posted and circulated. We want to ask all Washingtonians to look at those pictures closely. There's some identifying clothing. There's a very good view of the person who is being sought. And there is a reward of $100,000. So please look at these images, circulate them on your social media. This person could live here. This person could have traveled here. So we want these photos to go out far and wide. And we also know that several participants in the district's private security camera incentive program have provided the FBI with footage of the pipe bomb suspect on January 5th. So we know how important that program is, and it is helping us with these images. So if you have additional footage, contact the FBI's tip line at 1-800-225-5324 or submit tips online at tips.fbi.gov. If you are interested yourself in providing, signing up for the security rebate program, please go to ovsjg.dc.gov or email security.cameras@dc.gov or call 727-5124. So with that, we'll answer a few of your questions. Sam.
Mayor, the man who had the horns on at the Capitol when they invaded the Capitol, I understand he's at the DC jail and demanding organic food, and a court order said that the city had to provide it. You're looking like maybe you don't know much about it, but
I don't know.
you don't, because I'd heard about that, and I was just curious.
I read about it. I didn't know that he was at our jail. So let me get some information about that, Sam. Yes, Julie.
I'd like to ask about the return to schools this week. In
Sure.
the first few days, have any classrooms needed to quarantine?
Have any?
Classrooms needed to quarantine due to a positive test in the classroom?
No.
Great. And can I ask for an update on the temporary restraining order that the district has asked for regarding the union?
I think that the union issued some guidance to its members. If any of those, if anything in that guidance should change, I think that we would have to see where the restraining order is with the courts.
Thank you.
Yes.
I have a few questions for all of you, if that's okay. Thank
Okay.
you. So first, we had, if you could comment to this, I don't know if you, Dr. Nesbitt, want to comment to this, but we were speaking with the president of the Loudoun County NAACP earlier, speaking to the issue of equity and racial equality when it comes to the whole vaccination process. We know you all have prioritized different zip codes. You just announced the program with the seniors today. But can you speak to, the president was saying that they believe that this is blatant systemic racism and that you have to take the vaccines to the people. Can we get your response to that and more so on DC's plan to continue and really push in that effort?
Well, I'll ask Dr. Nesbitt to review it, who is our expert in equity in health delivery and outcomes, so she can speak to it better. But I think that you have seen over the last several weeks that we have rolled out the vaccine, and we have adjusted week to week to make sure that we're doing everything possible to go to areas that have been hardest hit by this virus and make sure that people have every opportunity to sign up for the virus. We've also been pretty focused on getting information out to people so that they can make informed choices about receiving the virus, and we will continue to do that as well. Dr. Nesbitt.
Sure, thank you, Madam Mayor. You know, we've been able to have some very constructive conversations and dialogue in our community over the past few weeks of our vaccine rollout. We're in week 8 of what we know will be a several months long process as we move through phases 1, 2, and 3 of the country's phased approach to vaccination. As you have seen highlighted in the slides today, as the mayor articulated, where we are allocating vaccines across our system is demonstrative of what an equitable approach to vaccination looks like. Not being completely privy to whatever discussion you had with the leadership in the Virginia County, we have been very clear that there will take a number of approaches to implement an equitable approach. Where we locate vaccination clinics matters. Here in the District of Columbia, where we are between 60 to 70 square miles, depending on what authority you reference, 68 square miles in the District of Columbia, we were thoughtful about where we located our vaccination clinics. But it is not difficult for a resident to move from one neighborhood where they live to another neighborhood to access vaccines, even if we locate our vaccination clinics in communities with a higher burden of COVID-related severe disease that leads to increased hospitalizations or increased deaths. Because of that, we knew, if you look at the presentation from today, that we also had to be thoughtful about how we allow people to schedule appointments for those clinics. And so as our program has matured, we've been able to apply an equity lens for that. We've also had to be thoughtful about how we've engaged with partnerships with providers who have advanced skill sets in being able to reach our more vulnerable populations. So having partners who can go to locations where people may have some of those risk factors or may have some of those barriers that are highlighted in the district's health equity report. And some of those may be transportation. So we've been thoughtful about partnerships with our senior housing communities where there's age restrictions and only seniors live in those buildings. And so this concept of taking the vaccines to the people, we are actually doing that in the District of Columbia. We have been very thoughtful about the age for our Phase 1B population. Many of you who have reviewed the district's health equity report know that by ward, our residents who live in Ward 8 have a life expectancy of 72. Our residents who live in Ward 3 have a life expectancy of 86. If you look at our 51 statistical neighborhoods, our residents who live in our neighborhood with the lowest life expectancy, that expectancy is 68 years of age. And the highest neighborhood, with the highest life expectancy is 89. If we would have began vaccinating individuals at 75 years of age or older, we would have missed the opportunity to have an impact in our communities with the highest burden of disease. So a lot of the decisions that we are making are completely focused on having an impact on equity, having an impact on those with the highest burden of disease. And we will continue to be flexible and nimble on our program on a weekly basis.
Thank you. And then another follow-up question to the slide with service members, veterans reaching out to the VA for vaccination. We're hearing complaints from other states, and I don't know if this is an issue in the district, but in other states that some who are trying to get vaccinated are being told that it's been so long since they've been to the VA that they're not going to be prioritized even if they might meet that age or category for vaccination, the group. In the district, will you all turn away a veteran if they can't get it from the VA, or have you heard of any of this at all?
So, Stephanie, I think the premise of I'll answer the premise of your question. You know, the District of Columbia, the government of the District of Columbia does not operate the VA hospital that's located in the district. So anyone who is being turned away from a VA medical center because of the date by which they access services from the VA, that is a decision being made by the leadership of the VA system, not one being made by that state or local government. So I would ask you to make your inquiry for that there. We will continue to be aligned with any federal or in communication with any federal entity that receives vaccines in our jurisdiction to understand what their plan for rollout is and to ensure that they are serving the population in our community that is supposed to have access to vaccines in that from that entity. So there are federal entities that receive vaccine directly. The Department of Defense, Department of Homeland Security, Bureau of Prisons, and the VA are 4 of those 5. And so we would expect that any veteran living in the District of Columbia would have access to vaccines in the VA Medical Center. But anyone being turned away, that is not a decision of the local or state government.
But we're not turning anybody. If they called us and a person was 65 and went through their portal, they would still be able to get an appointment.
Okay, thank you for that. And then just for the chief, if you don't mind, Chief Conti, we had a viewer very concerned reaching out about carjackings. Obviously, it's been a big issue in our area. Can you speak to any new plans to address this, what DC Police have been doing?
Yeah, thank you so much for that question, Stephanie. This carjacking issue, obviously, it's very concerning to many of our communities. It's an issue that we're seeing across the country and several other big cities. Matter of fact, there is a call today, a discussion with the Police Executive Research Forum today, specifically on this issue with other major cities. What we've done here in the city, we started our carjacking task force, where we're pulling in our federal partners to include the FBI as part of that. MPD has specific detectives that we are now assigning all carjacking cases to. Very recently, within the last 2 days, we've made an arrest for an individual over in the 6th District that's responsible for 3 carjackings. We have submitted some warrants to the United States Attorney's Office as a result of their efforts. And then last night, there was also an arrest of 4 juveniles that committed a carjacking in Upper Northwest, and that vehicle that they carjacked ended up over in the 7th District, and those 4 individuals were placed under arrest. So we want to be very intentional in terms of our efforts, working with our partners at DFS to leverage technology in the form of latent prints and that kind of thing to make sure that we do everything that we can to bring these carjackings under control. And obviously, in talking talking to our law enforcement partners across the country to see what other efforts they have on the way that may be helpful to us here in the District of Columbia. If I could add one other thing to that, one of the things that we're seeing with respect to these carjackings are people that are leaving their cars running or leaving them idling in the process of getting food and that kind of thing. So we're talking internally about what our campaign strategy will look like really kind of going forward to make sure that the public is aware of that. So that's also something else that'll be coming up.
Because there have been some situations where people were in the driver's seat in the car.
Oh, absolutely.
Pulled out of it. Any suggestions you would offer to people and how they can protect themselves?
Yeah, so I think one of the things, just out of habit, I've said this to my spouse and relatives, we have to rethink the way we do business. A lot of times it's easy to kind of sit in the car and to punch in the address for, that you're going to put into Waze and that kind of thing. You should do those things before you get into your car. Sometimes we sit in our cars and just eat. As an example, since a lot of the restaurants are not, fully operational, but obviously to be aware of your surroundings. But with many of the cases that we see, cars are idling, individuals are on their way back to the car, or they're getting gas or something like that, and then we have these, these carjacking / hop-in cases that are really, traumatizing folks in our community. So to the extent that we can have the community to kind of help us out with that, that would be hugely helpful in bringing carjackings down in our city.
Could I start with the buddy program? Can you tell us how many buddies there are going out, and if there's a senior out there or somebody whose parents, and they want to hook them up and connect them, is there a website or a phone number people can call to be connected to a buddy?
Well, right now, Mark, we have deployed our teams to knock on doors in areas that we're targeting and to reach out through the networks of the MOCRs and the Mayor's Office of Community Affairs. So seniors will be contacted.
So there's no way to do it the reverse way for a senior to contact a MOCR?
No, if we can get a number out to you for people to call their MOCR.
Okay. And then can I ask for an update on...
Oh, and Dr. Nesbitt reminded me that our target list, we started with a list that Serve DC uses for seniors who have signed up for assistance with shoveling.
Can I ask for an update on the Department of Employment Services website? There seems to be a problem that people are getting an error message. Do you know how many people this is impacting? Is this preventing them from filing?
I understand. I got a quick briefing before I came in, and I think they're going through a routine maintenance that should be rectified today. But let me have Dr. Morris Hughes give you a more substantial estimate of completion.
And if I could, for Chief Conte, a couple of questions. Is there any update on the investigation into the 2 deaths at the U.S. Capitol, either Officer Sicknick or Ashley Babbitt?
Yeah, so obviously that determination is made by the Office of the Chief Medical Examiner. So MPD's role in that is to make sure that the Chief Medical Examiner has all of the evidence that they need to make that determination. And obviously, Mark, in this situation with the Capitol insurrection, there were hundreds of videos and all of that kind of stuff. That stuff is being gone through and, again, funneled over to this. So they'll make their recommendation, once they have a better understanding of what exactly they're dealing with. Sometimes, and not to speak for the doctors, but when they are assessing and you have individuals that may not have visible injuries, that kind of thing, they have to be very thorough in their efforts to make a manner and cause of death, or to make a determination of manner and cause of death.
I'm sure you're aware there were press reports that there at least had been some preliminary determination by MPD that the shooting of Ashley Babbitt was, there were not going to be charges in that case. Can you speak to that?
Yeah, sure, obviously, and I heard about that, and that information was totally false. We're in the very early stages of this We have been in tight coordination with the United States Attorney's Office. They did a walkthrough of the scene on Friday, so they're nowhere near in making determination. And MPD, only thing that we would do in terms of preliminary is that we would get the facts as we know them from the day of the incident and then forward that information and any other potential evidence that we've recovered, forward that information to the U.S. Attorney's Office for review. But I mean, you've been in the city for many years and know that when you have officer-involved shootings, there's several months before any determinations are made.
I appreciate that. And one last question, I'm completely off topic. If I could just kind of close the loop on the Congresswoman who brought her handgun to D.C. and released the video, Lauren Boebert, I think is her name. You were going to reach out to her office. I'm just wondering, can you kind of close the loop on that? Did you ever have a conversation? And then also, have you gotten requests and have you issued any concealed carry permits to any members of Congress?
Yes, concealed carry permit was issued in that case. One of the things, if you notice from that video, the majority of that video, as it was filmed, was on the Capitol grounds, where members of Congress are obviously allowed to carry. But part of that video, it also appeared to be highly produced in terms of, they started out in a green room and then, it kind of went on from there. There was never any, I think there was an inference that the person in the video was armed, but you never actually saw the person armed with a gun. We learned after that press conference that there was a permit application that had been in the works for the Metropolitan Police Department, and as we do with all permits, if citizens are allowed to carry, then we grant them a permit. In this case, she was allowed to carry, and she was granted a permit, and yes, we did reach out to the office.
And could you tell us, is there a number of how many other members of Congress have been issued concealed carry permits? Is she the only one, or do you know of others?
I'm not sure in the universe of all the thousands of permits that we have approved exactly how many members of Congress prior to my taking this position have been approved, but I'm certain that there are probably others would be my guess.
Thank you.
Yes, James.
I have a question for Mayor Bowser and Dr. Nesbitt. Mayor Bowser, you may have already addressed this, but just expand on this. As you know, Ward 8 Council Member Trayon White wants you to declare a state of emergency throughout the city on crime and violence. He said this on Friday. What are your thoughts on this?
I think that the council member is right to sound the alarm about the senseless shooting and killing that's happening in some parts of Ward 8 that he represents. Many families have been tragically affected, and many people who are perpetrating these crimes haven't been brought to justice. So we need a focused and we need not just the government, but we need help from the community to make sure that we're getting to people before they commit these crimes, that we get to these guns that are allowing these conflicts to be so deadly, and that once we have the people responsible in custody, that there are real and certain consequences for their actions. We intend, and we have been working for some time on making sure that there is a structure in DC government that will be led by Linda Harley Harper, who is the district's gun violence prevention coordinator. I mentioned last week that we'll talk about how we will support an emergency effort, and there's different ways of talking about it, so I don't want anybody to think that we're establishing a state of the emergency in the way that we've had to do for COVID. But there is a sense of emergency, and we will stand up an emergency operation in DC government that we will be able to present to you in some detail very soon.
Okay, thank you. Dr. Nesbitt, it has come to my attention that in China, they have a different way of testing for COVID. Now, here in this country, we test through the nose and through the throat. But I have found out that they have tested through the anus. Now, what is your thoughts on this, and will this type of manner ever come here to the District of testing for COVID?
In the District of Columbia, we use tests that are approved by the FDA, and we are optimistic that the FDA will not only continue to authorize tests for use in the U.S. through its emergency use authorization process, but that scientists will continue to develop tests that are faster, that do a good job of detecting COVID-19 in a timely and efficient manner with a decreased risk of both false positives and false negatives. Now, how those tests are administered, where the specimens are collected, are not as important to us, but the important thing is that they are tests that the public will use. We know that many of those who were tested using the what was called the nasal pharyngeal test, which that many people talked about as being the tickling of their brain with COVID testing, people did not like as much as the test that is in the front of your nose or the test that is on the cheek. Or the saliva test that just allows you to dribble into a tube. So any tests that do the best job of detecting COVID-19 with the lowest risk of false positives and false negatives, we would welcome having.
Thank you.
I'll go Julie, and then I'll come around to Stephanie and Mark for the last round. Yes, Julie.
Can I follow up on this Buddies program? These are all staff from MOCA? They're not volunteers? You can't volunteer to be a buddy?
These are staff.
Okay. And when you're saying they're going to door to help people register, what are they doing? Are they getting on the vaccinate.dc website with them? Are they giving them numbers to call? How do they register them?
I don't know every step that they're taking, but they will be able to help them register, give them phone information. Everybody, I'm not sure that they meet, will want to proceed at that time, and then they'll be able to help them register.
But they don't have specific appointments that they can schedule them for.
They
can
will
just
have some appointments that they can schedule them for at a nearby location.
So there's specific appointments sort of designated for this program?
Yes.
Great, thank you.
Dr. Nesbitt, a couple questions for you. With this, and I apologize if you've already addressed this in previous news conferences, but with the variants that are now in the region, do you see another spike in cases? And then a second question to that is that in this now increased race to get people vaccinated, can you just go over again, what is the percentage for either the district or the region that needs to be vaccinated before we could get to some kind of safe point, and where are we at now in that process?
Sure, Stephanie. To your first question, there's still much that we are learning about the variants that would make it very difficult to predict whether or not, to some degree of certainty, we are going to see a surge in cases in the immediate future. And so much of whether or not we see an increase in cases depends on what our actions are. And how well we adhere to the non-pharmaceutical interventions, right, that we've been talking about, wearing masks, good hygiene, staying home when we're sick, keeping our distance, all of those things. Now, we do know that the variants do have presented in some countries where they have been detected as being the dominant strain, increased rates of transmission. The extent to which variants may, in our region, become the more dominant strain with these higher rates of transmission is unknown. How well we do at wearing our masks, keeping our distance, making good choices about the activities that we participate in, staying away from crowds, could help make sure that the variants that have these higher rates of transmission do not become the dominant strains of the virus in our region and in the country. But that's not something I can predict with a great level of certainty. Variants are common with any virus, and which variant becomes dominant again, is not predictable. In terms of what percentage of our population needs to be vaccinated for us to achieve a level of herd immunity, we estimate that it would need to be about 70 to 85% of our population. I'm glad that you've asked that question because there's a number of media outlets that are calculating percent of population vaccinated. And they are doing that based on the number of doses we've received and the number of doses that we've administered. Again, I caution people on using data that the district publishes and not using the data that we publish in the way that we publish it. We've been thoughtful to publish our own metric of the percent of our population that is covered or has been vaccinated. When you take our raw data and you calculate it yourself using census population estimates, your calculation is erroneous. And the reason why it's erroneous is because everyone who's been vaccinated in the district is not a DC resident. The number we calculate takes into consideration the proportion of individuals who have been vaccinated who is in fact a DC resident. So the number that you're calculating is much higher than the number that we're calculating. We'd be much happier for it to be your number, but it's not. So that's one of the things that we continue to see where some media outlets are reporting the total number of vaccines that we've administered during a calculation of our actual population according to census records, and then coming up with a percentage of our population that's actually vaccinated. That number is wrong. You actually have to take into consideration the percentage of the residents that are actually been vaccinated. You'll recall in phase 1A, the majority of people who we vaccinated were not DC residents.
So where are we now?
The metric is there. It's 0.9% in DC of the people who have been vaccinated in DC who are actually DC residents. We publish that weekly, and there's a map that we give you that actually shows where they are geographically by ward.
One more question for you.
Sure.
We have, news of other vaccines in the works that may, different storage, 1 dose versus 2 dose. What are your thoughts on whether the government should really just focus on creating more of the 2 that we know are out there and can help?
Well, this is another good question. Vaccines are often produced by multiple manufacturers. I don't think it would be wise or a recommendation I would make that we only have one manufacturer of a vaccine for COVID-19, because we typically don't have one manufacturer of vaccine for influenza or one manufacturer of vaccine to protect us from any virus. It's also important for people to remember that having a vaccine that has 60% efficacy, 70% efficacy is a great vaccine. I think we were all very surprised and elated to have the first 2 vaccines that were that finished their phase 3 clinical trials to have 95% efficacy. In that vein, if subsequent vaccines have efficacies in the range of 70%, 75%, 80% overall, and at 85, at 90% against severe disease, those are still very good, great vaccines. So there's a total picture and context that we need to be thoughtful about as additional manufacturers' vaccines become available. The other thing is that making pharmaceuticals is no small task. And so the more manufacturers we have producing COVID-19 vaccines, the greater supply we have overall in vaccines that we can get out to our public, increase our vaccine supply, have greater confidence in the supply chain that's going to be available in the U.S. So having 6, 7 manufacturers making vaccines can do great wonders for our ability to vaccinate our population in a much shorter time. And I think you've all heard Dr. Fauci say that the faster we vaccinate our population, the much better job we do at lowering our risk of having these variants become dominant in our country. Yes, Sam?
For Dr. Nesbitt, the Biden administration said they were sending, vaccine directly to drugstores. Are any of the DC drugstores involved? I just didn't seem to notice if whether the CVS's or Walgreens here were getting direct shipments.
So you all are aware that the district has its own local retail pharmacy program that we began in the second week of our program of our vaccination program. It's extremely robust. It has worked well. We are in conversations with the federal government as it launches its federal retail program, that it aligns with what we are doing here locally. So as we finalize those details, we will look to see how we can take advantage of the federal program.
So the local drugstores are administering vaccine now.
Correct.
But will you, because I guess there was a limited supply sent out. Will they get more now with this, or?
So we're in discussions as to how we can leverage both programs in order for the retail pharmacy stores in our city to be able to access the federal supply.
I see. And then one question for the chief. Apparently there's some activity, particularly with the Capitol Police and the Proud Boys. I know you're investigating murders, or homicides, but do you investigate anything else with respect to what happened on January 6th?
No, the FBI is because that was on federal property there. The FBI is really the lead investigative body for that. We are working very closely with them, obviously, providing video, member accounts, that kind of thing, and working closely with them. But it's primarily their investigative responsibility.
Okay, Mark.
Just quickly for Dr. Nesbitt, have we seen any of the variants in DC?
No, we have not detected the three new variants that are that people are referring to: the UK variant, the UK or British variant, the Brazil variant, or the South African variant. But as I mentioned before, variants happen with viruses, and so we have been doing gene sequencing for several months, and there are different types of variants that are in the district, but not the ones that are of popular discussion now.
Thank you. And Mayor Bowser, a couple of off topic. Governor Hogan yesterday renewed his effort to move the FBI headquarters to Maryland. Could you remind us of what your position is, what should happen to the FBI headquarters? One, the actual building there on Pennsylvania Avenue, and then whether they should relocate in the district or out of the district?
Well, Mark, thanks for that question. And we believe that there's a better use for the current FBI building on Pennsylvania Avenue. We also believe that the FBI wants to stay in Washington, D.C. And so what I have directed my team to do is to continue to work with them on their needs. Do they need all of the people to be in the same place? Are there, ways to break it up? Or are there other larger spaces in the district that they would be interested in?
So you would like to keep the FBI in the district, just not on Pennsylvania Avenue?
That's correct.
And then could I ask you again about the fence? You went through the fence at the Capitol yesterday when you went to honor the fallen officer. Just again, your thoughts on whether or not that fence that spans for blocks and blocks and blocks, really surrounding much of an entire quadrant of that area, is it an overreach? What are your thoughts on, I know you don't control how long it's going to be there, but what do you say to these small businesses and restaurants who are being impacted on Capitol Hill because they can't cross that path?
Well, let me start by my visit to the Capitol yesterday. Chief Conti was also there. It was a very solemn ceremony. I want to thank the speaker for inviting me and to represent our officers, the District of Columbia, and really every American who watched in horror what happened that day. I will say, Mark, I didn't fully appreciate the trauma that the members and their staffs are going through, and the real fear that they're living with every day. The members of the Capitol Police Force as well, who have experienced a lot of trauma, and our own officers who were there and experienced some really difficult battles. And so I first want to just appreciate what those people felt. They felt scared for their lives. So I want to say that. And I want to say how sorry I am and how much our hearts go out to them as they're going through their healing processes. It is also important, however, that the investigations that are underway and the security reboot that the speaker has talked about, that General Honore is leading, and I'm sure there will be more in-depth reviews as well, that they are thorough, but they also consider how to secure the building without locking out the public. And that would be where I stand. We want the members to be safe. We want the buildings and grounds to be safe, but we also don't want it to be fenced off from the city, from visitors, and that has some practical implications that you've discussed. But I think it has it sends a broader message about democracy. From our nation's capital to the world. So I'm confident that the people involved will make sure that we're having a more robust security posture without walling off our capital. More than that, I've said here previously that I've directed our Homeland Security Director, Rodriguez, to also undergo a review of our security posture with the Chief of Police, given the threat of white supremacist violence in our city. And not only are we concerned about the Capitol building, we're concerned about everything else. And so we are undergoing that review as well. Thank you, everybody.